Hello, good evening, namaste. This is Dr. Chetna Jain, Director, Nema Elder Care at the Gurgaon. We are into assisted living for elderly. Today is the Geriatric Depression Day. That means depression in the elderly. So we are going to talk on depression in elderly. So depression in elderly is very unrecognized. People do not come across. People are depressed, but the people around fail to understand that their elders are depressed. Such older adults they remain undertreated. Many older adults who die by suicide, that is up to 75%, they suffer from depression. And if you take history, most of them have visited a physician within a month before death. Untreated depression can delay recovery or worsen the outcome of other medical illnesses via their increased morbidity and mortality. That means more disease and more chances of death. Mind it, depression is not a part of normal aging. So it's not that because you're getting old, you're supposed to be depressed. 15% of the elders have minor depression, wherever 1 to 2% of elders have major depression. Now, how to differentiate between is feeling depressed and the depression are the same thing. A lot of us will feel depressed at some point in life, but that doesn't mean that we are into depression. Sadness is a healthy emotion to feel when faced with difficult situation, and usually we cope and recover soon without treatment. A person who's feeling sad might express emotion through crying, would like to spend time alone, can maintain regular eating and sleeping patterns, can participate in regular activities such as work or school, starts feeling better in a few days or weeks. A person who has depression might experience unusual feelings of sadness, anxiety, guilt, anger, hopelessness, helplessness, and irritability. And these symptoms will last for 2 weeks or more. Move, it might move more slowly, or sometimes the person becomes very agitated and the person is unable to settle. Patient might have sleeping difficulties or sometimes sleeping too much. There could be loss of interest in activities that used to be enjoyable. There could be thoughts about self harm or suicide. So, what are the risk factors for elderly depression? One is alcohol abuse or a substance abuse, or somebody who's been consuming alcohol a lot over several years can actually start feeling depressed. Current use of medication. So, there are certain medications which can lead to depression. Then, hearing impairment, if with the loss of hearing or loss of vision, which is severe, can also affect the function and hence can lead to depression. If somebody has history of attempted suicide, this is also risk factor for depression. A history of admission, hospitalization for psychiatric illness, that's another risk factor. If there's a medical diagnosis which is associated with high risk of depression, like a cancer thing, new admission or change of environment can lead to depression in elderly. Then there could be stressful losses like loss of body function, loss of privacy, loss of a family member, loss of a friend, all can lead to depression. Then there could be personal or family history of depression or mood disorder. This is seen more commonly in women, wherein they go in post delivery depression. And when you take history, such a history is also found in their mothers. Now, when we talk about early, then how do you identify depression? So there are criteria. So here we are talking about DSM-4 definition. So 5 or more symptoms need to be present in the same 2 weeks interval, and they should represent a change from baseline. That means if somebody's been like that for several years, then this cannot be called depression. But if there's a change from baseline and it is more than 2 weeks, in the last 2 weeks especially, and the symptoms are more than five, then we can consider that this person is depressed. And one of the symptoms must be a depressed mood or loss of interest or loss of pressure. So, what could these symptoms be? So these symptoms typically occur every day and most part of the day. So they are depressed mood, loss of interest in all activities, so no pleasure, which is also known as anhedonia, change in appetite or weight loss, lack of sleep or excessive sleeping, psychomotor agitation or retardation, that means very aggressive or completely given up attitude, loss of energy or fatigue, feeling of worthlessness or excessive guilt, difficulty with thinking. These people are not able to think, concentrate, or take any decision, recurrent thoughts of death, recurrent thoughts of suicide, or preoccupation with symptoms which are non existing, like a pain abdomen, or too much worry about the health status, or too much worry about the physical limitation. So, any of these symptoms, if there are more than five present in last 2 weeks, could be a sign of depression. Now, there could be various types of depressive disorders. So, one is a mild episode. So, it is a major depression, but the episode is mild. Then it could be a moderate episode, could be severe, or finally, it could be severe episode with psychotic features. So, these people are extremely aggressive. So, somebody who's aggressive can also be depressed. Now, there are various medications which are causing depression. So, this is a list of, I'll just briefly speak out. So, some kinds of steroids. Now, cardiac medications, which is antiarrhythmics like amiodarone, anticonvulsants, that is for the epilepsy, then barbiturates, that is, and benzodiazepines, these are sleep medications, carbidopa or levodopa, then medicines to reduce the heart rate like propranolol, then medicines to control BP, clonidine, and the cytokines, digitalis preparations, prednisolone, H2 receptor blocker, which is taken for acidity, metoclopramide, anti-vomiting, or opioids like morphine kind of things, which which are strong painkillers. So all these can lead to depression. There could be laboratory tests which are available for evaluation. So the list of tests can include some electrolytes, that means kidney function test, a complete blood count, serum levels of various drugs, thyroid function test, EKG, blood levels of folic acid, and vitamin B12, not to name a few. Now, what could be the differential diagnosis? Means there could be other diseases in the body which might mimic depression, and we just feel that the person is depressed. So before labeling any person depressed, we must rule out a lot of other things. So the list of the things which we need to rule out are the thyroid disease. It could be low thyroid or high thyroid, a dementia, which is essentially a neurological illness with mild cognitive impairment, a bereavement wherein somebody's lost somebody very close, a friend, a family, or something very personal, anxiety disorder. Anxiety should never be confused with depression. Then substance abuse, that it could be alcohol or drugs. Then personality disorders, need to look into psychiatric illnesses. Then the diabetes, underlying malignancy, that means the cancer, that be very low hemoglobin anemia, or it could be side effects of certain medications which a person could be taking. Now, how to differentiate between depression and dementia? So, dementia is essentially a neurological problem, whereas depression is more of a psychological or psychiatric problem. So, depression has a subacute onset, that means it will suddenly start, whereas the dementia will gradually build in. Then family will recognize depression early, but dementia family will fail to recognize for a very long time. Depression will rapidly progress, whereas dementia will progress relatively slowly. In depression, there is impairment which is inconsistent over time, so sometimes it is better, sometimes it is not. But in dementia, impairment is consistent, it is slow, it is gradual decline in various functions, but patient denies any of and is unaware of any deficits. However, in depression, the patient admits that patient has deficits. In depression, patient appears depressed. In dementia, the patient is not depressed. In depression, there is anhedonia, that is loss of pleasure. But in dementia, patient can experience pleasure. Abstract thoughts are usually normal in depression. Abstract thoughts are impaired in dementia. I do not know is the response to questions in depression. In dementia, the answers are near misses. They try to answer to the best of their ability, but they are shooting the answers and not hitting the point. In depression, the patient is often unconcerned. In dementia, the patient tries to cover up. It tries to cover up the forgetfulness that the patient has got. So that's how you can differentiate between depression or dementia. Now, what is a geriatric depression scale? So, geriatric depression scale is a scale, it's a screening tool for diagnosis of depression in elderly. So, you take up all the questions, so it ranges. So, if it is 0 to 9, it is mild. If it is 10 to 20, it is moderate. And if it is 20 to 30, then it is a severe depression. So, it is used to discover, that means identify depression and also to categorize mild, moderate, and severe. So it's a very simple questionnaire for which marks are given 0 and 1. At the end, the score is calculated. It is seen, it is available everywhere. So why depression in elderly needs treatment? The consequence of depression in the elderly requires serious attention because elderlies have very high risk of suicide. In India, we do not have enough data, but if we talk of United States, 13% of the US population was 65%. But amongst the all suicide, the suicide rate was 18% amongst these elders. So it was very clear that elderly they commit more suicide. In India, because of joint family, nuclear families are they are not there so much, so the suicide rates are less, but they are rising, and we need to be alarmed before they reach disproportionate levels. Now, what treatment should be undertaken for depression? So the goals of therapy are we need to improve mood, function, and quality of life. So the goals of the treatment of an acute depressive episode are to achieve recovery and prevent future episodes of depression. It's not just that we just want some resolution of symptoms. No, we want complete resolution of symptoms and not just simply a reduction in the depressive symptoms. So, three phases of treatment are generally required to achieve these goals. So, these three phases are one is an acute phase. So, this acute phase, the duration is about 3 months, and this is to reverse the current episode. The goal is complete recovery from the signs and symptoms of acute episode. That means whatever has happened, the person within 3 months should go back to normalcy. Then the second phase is continuation phase. That means you want to prevent a relapse. You want to prevent this episode occurring in future. So the duration of 4 to 6 months. The goal is to prevent it as treatment continues, as the symptoms continues to decline and the functionality improve. We keep on working on that so that we never have any acute phase. And finally, a maintenance phase wherein we prevent a future recurrence. So duration of this maintenance phase is about 3 months or longer. Goal is to prevent recurrence of a new depressive episode. So, what kind of treatments can be undertaken? One is a pharmacotherapy, that means a medical treatment, wherein certain medications are given. A psychotherapy, wherein it involves counseling with a psychiatrist and a psychologist, and, and in a very severe case, sometimes ECT or electroconvulsive therapy might be needed. Patients should be monitored for response to treatment. That is very important. So, how do you monitor the patient for the response to treatment? One is you observe for the resolution of signs and symptoms of depression. You must document improvement in the scores on the screening tools. So, one of the screening tools we talk about geriatric depression scale, and there are too many others. Improvement in attendance and at and the participation in usual activity. So suppose there are board games or carom boards or any other, suppose Diwali celebrations or certain things. So you see how elderly is participating in that. So if there is improvement in attendance and participation, that means the the depression is getting less. And improvement in sleep pattern, that means the sleep is coming to normalcy. Also, we need to monitor these patients carefully for the side effects and the interaction with other medications. So it is important while we give pharmacotherapy to see how these drugs are interacting with other people. Now, should the elderly people experiencing bereavement be treated for depression? That means if any senior has lost something and is in grief, is bereaving something, shall we treat them as depressed? The answer is no. But if the symptoms of major depression persist for more than 2 months after the loss, then treatment of depression should be strongly considered and an adequate evaluation, counseling, and adequate treatment should be considered in 3 phases so that the disease can be reversed completely. So, psychotherapy includes cognitive improvement, behavioral improvement, interpersonal discussions, short term psychodynamic treatment, life review, reminiscence, problem solving, supportive treatment, bereavement therapy, behavioral therapy, dialectical behavioral therapy. So, there are many things that a psychotherapist can do to improve. The pharmacotherapy, when you're giving any treatment, you must look into what comorbidities the patients have, what are the side effects of the various drugs, and what patient can tolerate, what are the sensitivity of the patient to these side effects, and what are the drugs potential for interacting with other medications that patient has been taking. So all these need to look into before any treatment can be instituted. ECT is used very rarely and it is used in depression for pronounced psychotic features and resistance to standard medical therapy. So, this is used as a last resort. It is effective for treatment of major depression and mania. The response rates is more than 70% in older adults. Now, what is the treatment response of pharmacotherapy? So, about 40% cases of major depression, they respond well to medical management within 6 weeks. An additional 15 to 25% will also get better with continued treatment for another 6 weeks. However, there are reasons for partial response or treatment failure. So, dementia. If somebody is having dementia and we are treating them for depression, the response will be poor because dementia is confused with or accompanied by late life depression. Similarly, concurrent psychosis, this also interferes with diagnosis and interferes with the diagnosis and treatment of depression. Then compliance is difficult when the patients are depressed. So it is very important to monitor them. So today being the World Geriatric Day, we wish that all elders are looked after. And if we identify, if we recognize any symptoms of depression, we should be able to pick them early and put them to rest and ease before it becomes severe and untreatable. Thank you very much. Thanks for the patient listening. This is Dr. Chetna Jain on the Nema Talk Show. We are from the Nema Healthcare. I think there's some question I can take. So the question is, please explain how to handle depression in elderly and sometimes your working parents are outside and our parents are alone at home. It's very sad scenario, but the truth is we want to give time, but we cannot. We understand that, and for the majority, this is the situation. Sorry, sorry about this. So we understand that. So for majority, this is the situation that we want to give time to the parents, but our time is divided into many things. One, we have small children, then we have our work commitment, then we have to keep our own fitness, and then to spend time with parents. Now, if the parents are together in the house, then probably we have to schedule a complete half an hour to 1 hour for them, either early in the morning or little late. But if they are not together, then probably you have to have a video calling kind of system set every day, irrespective whatever. If you cannot do it and you have siblings, you need to have a roster that, okay, Monday this person will call, Tuesday this person will call. Because the only respite the parents have at this age is talking to their near and dear ones, and nobody can be better than their own children. So there is no way that, you know, you cannot supplement the deficit of time with any other medical treatment or any other thing. If you have volunteers around who can spend time, and if you think it's safe, so some volunteers can get in touch. Nema also has got volunteers who can speak to elderly at home if required be. But the background needs to be known, otherwise it will be very difficult to talk. And sometimes the family may consider it unsafe for outsiders to talk. So uh, and providing a bed if they like, that's another thing. If some neighbor can come and sit with them, maybe you can hire someone to sit with them every day for 2 3 hours. So these are the things which can be done to probably alleviate their anxiety. So my dad got his retirement in 2017. After the retirement, he lost his brother. He least bothers about anything. He barely talks. He always stays in his room and sleeps. He is interested in no activity probably now. What can we do? So first of all, he needs counseling. He has gone into chronic depression. So this needs a lot of time. So as we discussed, it might need up to 6 months of hard work before this can come out. We at Nema and the Cure are doing help to such people. We have such big people who can come and stay with us. We do a lot of activities, talking. We have volunteers, we have care attendants to look after them. So he can come with us, spend time, and we can try our best. And there's a good chance that he will come out of depression. If you're not around in NCR and you want to use a facility somewhere else, please try and identify a similar facility or some dedicated team who can do a similar job. My mother is suffering from heart disease. We came to know about her disease 3 months back. Since then, she's very depressed. She thinks she's going to die. Please help so that we can assure her. So, what is very important is you have to talk to her. Tell her that 3 months have passed and nothing has happened. And you also tell her, you speak to her doctor and let the doctor tell her that the risky part is over. So I cannot read if I do it like that. I will not be able to read it. That's a problem. So you should. So what I'm trying to say is, you should you should try to make her doctor speak to her so that your risky period is over. Now you are in a healing phase, that you will recover very fast, that you don't need to worry about it. So when your treating doctor will give you suggestion that you are improving, then it will go into her mind. Otherwise, it is very difficult for an elderly. Once they have any diseases, they start stuck. They get stuck with that. They believe that this is the end of their thing and they are incapacitated. They are too worried about their future. So please ensure, tell her that you'll be around for anything that she would need, but she's absolutely fine and she doesn't need anybody's help. And this has to be coming through her treating doctor. So, what in depression, what exercises are advised to have peace of mind? Now, it depends on what kind of physical abilities the elderly has. If the person is fit, it is a good idea to take simple walks and try and talk to people around. So, if you live in a society, you will find a lot of elders walking around. And if your elder can also join the same group, talk to them, then people realize, oh my God, the other people have much more problems than what I am. So, this helps. Other than that, if the elder is bedridden, cannot go out, then there could be certain breathing exercises. If the elder can sit, then yoga. Otherwise, lying also, meditation can be undertaken. If not, then you can take the help of counselor or psychologist or yoga teacher who do all these things. So there are many, many people available at a very good price and not very expensive who can do this, and the elders can actually make you feel better. They should also be encouraged to participate in a home activity, the way we encourage children to participate in activity and give them uh, the kudos that okay claps that okay they have done this job well, so they will also feel encouraged and do it further. So it is very important for us to encourage our elders to do their chores, to do other things and whatever. And if they make some mistake, because as they grow old they become a little infirm, unstable, sometimes they might break some cutlery, sometimes they may drop some dal or some other thing, and then there's a lot of cleaning to be done. So they should not be made ashamed of that. So there was another question for coming up. I lost that. So what type of things should be avoided to prevent depression? So one is staying alone. Second is grieving about certain things too much. So these are not the right things. So it is very important to participate in day-to-day activity. If there is some loss of anything, like loss of body functions, loss of vision impairment, hearing impairment, friend, family, or anything, there has to be way or means to overcome that problem. Like somebody's having hearing loss, should use hearing aids. If you have a vision loss, you must wear glasses or try to get yourself operated. If you think you're not able to walk well, take stick, take walker, take a wheelchair, do whatever. You also need to listen to very to inspirational stories. Probably go and speak to gurus, yogas, and if you cannot go out, you can be on a Zoom call. You can attend these workshops if possible. You can ask for volunteers to come in. So there are many things which can be done. You can do certain creative. If you like to paint, paint, whatever. Even if you spill, it's okay. You like to cook, cook. So do whatever you like, because when you create something, this immense pleasure and this depression will go. So depression doesn't affect only elderly, but today, being the World Geriatric Depression Day, we were talking about depression in elderly, but the same applies to each and every human being. And sometimes children who are very young as 10, can also be depressed. So no depression should ever be ignored for anyone. Now, we are transferring to some other city. My parents are very attached with our kids and will be devastated when they will get to know about this news. Please help so they can take this news easily. Yes, it is very difficult for parents to lose their grandchildren to transfer. It will be very, very hard on them. So, um, this news has to be broken very slowly. And if possible, the parents need to be taken along for a short while, stay with you first, and then they gradually increase the period of coming back to their own city and staying away from you. And meanwhile, ensure that your kids have regular Zoom or whatever video chats with their grandparents. And also, if you have other siblings and if your parents have other grandchildren, then it is very important that they interact with them also. So the idea is to keep them engaged in some or the other way. It should not be that you've gone to another city and they've forgotten. So, and this communication, if required, can be tapered very gradually, but initially, a lot of time would need to be spent. That means settling down in a new city, new house, everything new. And on top of it, you have to give a lot of time. So, probably you will have to designate this work to your children, because children these days are very smart. They can handle the IT gadgets, they can do the video things, and probably keep the grandparents engaged, show the new house around that we are putting this picture here, doing this here, we are joining this school. Keep giving all the information to the parents so that the parents feel a part of the home, and also keep asking about their health and if they need anything. you should be able to arrange it from wherever city you are. So you have to ensure that you have some friends who can, or volunteers who can look after your parents in your absence. Is depression can be passed to generations? Yes, this is a wrong, this is a sad thing. The problem is depression is sometimes genetic. About 5% of depression can be genetic. So it's more common in women, especially. So when you have your mother being depressed, there's a chance that the daughter gets depressed. The depression could be having certain episodes. Like a lot of women get depressed during pregnancy, or others might get depressed during breastfeeding, or so during the postpartum period. So whatever it is, we need to recognize the depression, point it out to the family member, do whatever you can. Sunlight, healthy eating, healthy sleeping, interacting, participating in activity, and try and understand that whatever loss or inconvenience which has happened in causing this shall pass. So if all this is put in mind, there is a good chance that depression will go away. But certainly those who have family history of suicide, attempted suicide, self-harm, hospitalization of psychiatric illness, have family history of depression, they stand a greater chance of depression, and they should ensure that they keep an eye on these symptoms, and if any time such a problem arises, then we need to look into that. Yes, depression can lead to other health issues. That is certain. As you understand, people who are happy mind is happy heart. So if somebody is depressed, can certainly affect a lot of body functions, thyroid, neurological illnesses, heart disease, and other problems, diabetes, lack of physical activity, weight gain, obesity, sleeping disorders, and too many other problems can come in with depression, eating disturbances, nutritional deficiencies, so many things. So depression, it can be a serious cause and can lead to various health issues, numerous health issues rather. And there's a possibility that long-term depression, the people may not survive very long because of affected body functions. And a lot of medications will be added to them, and then there'll be a lot of drug interactions, a lot of issues, and because of the medication, maybe there'll be further depression and further sleep. So it is extremely important to control depression at a very early stage in whatever best way possible.